What's up, everybody? It's the PA Professor back with another video. This video is going to cover the final cardiomyopathy. I said that in the last video, but there's actually one more on the list. So today we're going to cover stress, or also previously known as Takotsubo cardiomyopathy. I just call it stress cardiomyopathy. And again, if you know nothing about this disease, just look at it, read the words, break it down, and interpret. Stress has something to do with a stressor. Cardiomyopathy, by now you should know this is disease of the heart muscle, right? Some sort of problem with the heart muscle due to a stressor. So let's jump right in. This definition is high yield. You need to know this. What is, in layman terms, oh no, this is not layman terms, but what is, in medical terms, stress cardiomyopathy? Well, it's when you have transient apical ballooning of the ventricle that causes temporary systolic dysfunction. What is all these fancy words? Okay, let's look right down here. Transient apical ballooning. You see, this is the apex of the heart, right? You see how it's widened? This is called ballooning of the apex, or transient apical ballooning. And what this does is it kind of sends the heart into a temporary dilated cardiomyopathy, or a temporary pumping problem, because you see how the walls are thinned out, right? Where a normal heart, it's kind of thicker and stronger looking. Well, in stress cardiomyopathy, the walls are thinned out, and it's almost like you can't pump blood like you're supposed to the rest of the body, right? Another high yield thing is stress cardiomyopathy can only be present in the absence of any heart disease. I'll say that again. Stress cardiomyopathy can only be present in the absence of any heart disease. So if this patient comes in with chest pain and they have they have a little bit of transient ST segment elevations, and you look at an echo and you see a little bit of ballooning, but they have a history of coronary artery disease and heart failure, it cannot be cardio or stress cardiomyopathy. This can only be present in the absence of any heart disease. And we'll go over a vignette later, and that'll kind of make it more clear. So what's the cause of stress cardiomyopathy? Well, obviously it's in the name. A stressful event will precede this transient apical ballooning. So a vignette will have to give you some sort of serious event in the patient's life that preceded their symptoms. So usually when I saw it, it was a death, right? Someone's grieving over a death. But other stressors can cause it too. And this risk factor right here, it says postmenopausal women. This is kind of low yield, but it has something to do with the cardioprotective effect of estrogen, because this patient population of postmenopausal women are estrogen deficient, right? So if they lack that cardioprotective hormone, then they're more likely to get this transient apical ballooning. But this is low yield. You need to know this. Symptoms, more than likely the vignette's going to say these people come in with chest pain or shortness of breath, right? Obviously, if you can't pump a lot of blood to your body, right, your coronary arteries aren't getting a lot of blood, and you could have some chest pain, almost kind of like mimicking a acute coronary syndrome. So this would be in the vignette, probably chest pain. Some signs and physical exam findings. Obviously, you could have some chest pain, right? Because if you're not getting a lot of blood pumping, if you're having a systolic dysfunction, you're not getting a lot of coronary arteries to fill with the proper amount of blood, and you can have some chest pain. But there's no pathognomonic findings, kind of like some other cardiomyopathies for the stress cardiomyopathy. It's really just the definition and the etiology that you have to know. Your workup. So, if this patient presents to the ER because they think they're having a heart attack, right? You're going to do a EKG and you're going to pull a troponin, right? Sometimes this can show ST elevations, right? And sometimes your cardiac biomarkers can be positive. Why is this? Because if you're having a systolic dysfunction, right? What if, the coronary arteries aren't being filled properly? Then you're getting this lack of blood supply going to the heart, and sure enough, your heart can be injured because of this, right? These are low yield though. The board is not going to try to trick you and make you think that this person's having a heart attack, right? They're not. So instead what they're going to give you is they're going to give you probably a normal EKG, probably a normal biomarkers, but then they're going to say, you went down the line and you did an echo, and in the echo you noticed transient apical ballooning. This is high yield. You have to know this 100%. My question on my boards, I think just ask what's the echo finding for someone with stress cardiomyopathy, and it's this transient apical ballooning. You need to know this, and then obviously it might give you. We said that stress cardiomyopathy is only present in the absence of heart disease, right? So you may go on to do a coronary angiography in these patients, right? But they're going to find nothing because it's only present in the absence of heart disease. So that's also something the vignette could throw in, but this is the high yield topic right here. You need to know that on an echo in stress cardiomyopathy, you will see transient apical ballooning. Treatment, how do you treat this? Well, this is usually a self-limiting kind of disease because it's just caused by that stressor, right? So you're just going to give them supportive and reassurance as their treatment. Obviously, if they come in with chest pain in the ER, yes, you're going to, administer aspirin and all the good stuff that you do for ACS. But for what the boards would want to know, you just do supportive reassurance treatment. You can also throw in a beta blocker if they're tacky or something like that and you can't get it down. But the boards are just gonna, this is very low yield for the boards, and if they asked it, they would only ask for reassurance basically. So let's pull it all together with this high yield vignette question. And this is probably 75% of what this question would be like on stress cardiomyopathy if you get a question on it on your EOREs, EOCs, or boards. So a 62-year-old female presents to the emergency department with progressing chest pain. Are they having a heart attack? She states she lost her husband in a freak accident 3 days ago and started to notice the chest pain shortly after. Right there from these first two sentences, you should automatically be thinking stress cardiomyopathy because the boards will only throw this question or this sentence right here if it means something. So she states that she lost her husband in a freak accident. So this is a major stressor for her, right? Okay. Her past medical history is of no significance and she is considered healthy. This is another reassuring sentence that, this is in the presence of the absence of any heart disease, right? Because she's considered healthy. And EKG shows she's sinus tach at 101. So, 101, not super tacky, but she's a little bit tacky, probably because she's anxious. And then it says 325 milligrams of aspirin was initiated. However, shortly after arriving, her troponin comes back negative. So she's not having a heart attack, right? And you pull the EKG and it just shows sinus tach, no ischemia, ischemic changes or anything like that. If stress cardiomyopathy is present, which you should already be thinking this is stress cardiomyopathy, what would confirm the diagnosis on an echocardiogram? I'll give you like 3 seconds. You should know this off the top of your head. It's the most high yield thing about this topic that you need to know. Yes, if you got it right, good job. Transient apical ballooning or temporary systolic dysfunction. This first part is probably your more high yield answer, but they could also say temporary systolic dysfunction because that is what is a result from this transient apical ballooning. So guys, that is the last of the cardiomyopathies. That is stress cardiomyopathy. If you like this video, give it a like, subscribe if you've not already, and we will see you guys in the next video.